What's going on, everybody? Well, Dave back again, and I am finally home. Holy hell. So my first rant, I find it amusing that I've gone a couple of months without doing videos, or even doing videos, and I haven't had any issues with YouTube flagging my videos for not being acceptable. And so yesterday's video from the hospital evidently is unacceptable by YouTube, so I don't know what the deal with that is. But I thought I would just give you guys an update. A lot of you guys have been super supportive. I appreciate that. If you've seen my post on Facebook, you kind of know what has been going on. It was just a freaking nightmare. So I'll give you guys a brief rundown of what ended up happening. And sorry, I'm going to be clearing my throat a lot because my throat is still really bothered from the intubation, from the surgery. So I end up, like, after a couple minutes losing my voice. Not completely, it just, I kind of have to force it. Anyway, so what ended up happening is, you guys saw the one picture of me in the back of the ambulance. That wasn't even the worst that my foot was. They actually straightened it out a little bit. My toes were actually pointing the complete opposite direction of my leg, which was no freaking bueno. I'd gone to the grocery store to get a couple of things. It was about 11:15 p.m. and I grabbed some stuff for Heidi, and I grabbed some stuff for myself. I had like a half gallon of milk. I had a can of Arizona iced tea, a couple other things in my backpack. I did have my skateboard with me, but I wasn't riding it. The roads with where I live and over by the grocery store are bad enough that I won't actually ride on them. And I always figured if I ended up falling and then if I ended up breaking something, it was going to be while I was on the board. No, I was carrying the damn thing. So I made it across the first two lanes. I made it to the median. All right, you can come up. Sorry, Tigger's trying to make his way up. There's Tigger. So I made it to the median, and there was some guy. He was crossing the road up the way, and he was just making a bunch of noise, and I was paying attention to him. About the same time, a car had gone by, and I don't know if I just lost my balance stepping off the curb. I don't know what ended up happening. And yes, if the color fluctuation, I have the TV on, so it's throwing off color over there. I'm kind of tired right now because I managed to find a way around my house. We'll get to that here in a second. So I stepped off the curb and down, and I don't know if I just caught the edge of the curb just right or what ended up happening, but next thing I know, I'm down. My leg is folded underneath me one way, but the bottom of my foot is actually on the ground. I can see it, and I know something's ended up happening. And I actually thought that I had broken further up my leg. That was my fear. This was also another fear. I am now halfway into a lane into the traffic, and you know, it's late at night, so there wasn't a lot of wasn't really any traffic, but I know drivers here, and they just don't give a crap. They either not see you and hit you or go around you. So I proceeded to, I don't even know how my board managed to roll to the other sidewalk. When I fell, everyone was surprised I didn't have any contusions like on my arms or anything, but when I had fallen, somehow this shoulder had ended up coming down onto the ground, and my backpack was between the ground and my shoulder. So that was like my saving grace. I never do both straps on my backpack. I always have it just over one shoulder. And then come to find out, when we took out the half gallon of milk at the hospital, it had pretty much broken my fall. It didn't burst, but it was one of those cardboard ones, and it was completely crushed and everything. So I drug myself across a lane and a half to the sidewalk on the other side, trying to tell myself not to put any pressure on the 1 foot, but just to make it across. Of course, you know, if you've ever been in that situation or anything, it was just like panic and shock and adrenaline pretty much taking over, so not really feeling anything. So the first thing I do is I sit down on the sidewalk. I'm holding up the one leg with my arm. I've got it hooked underneath it, holding it up. I call 911. I tell them where I am. I tell them what ended up happening. They say someone will be with me shortly, and they hang up. And the ambulance was there within 2 minutes or so. Now, my wife had already gone to bed, and so, I mean, I knew that she wasn't going to know anything until she woke up for work at 5 a.m. the next morning. So, I mean, I was trying to send her updates of, hey, I'm going to this hospital. This is what I know right now. Don't panic right now. So I sent her a message and so forth. Ambulance comes by. They pick me up. They're like, holy shit balls. They did kind of straighten out my foot a little bit to where it was like this with my leg. But they get me to the emergency room at the hospital. ER staff was actually quite awesome. It was funny. A lot of people were asking me, hey, is that what those electric skate? And part of it was they were trying to keep me distracted, and another part was they actually had interest. So, you know, I get there. They're giving me medication. They're giving me shots of fentanyl, which it's quick acting, but it's also dissipates quickly. And I told them, I go, I already know from horror stories that you guys are going to have to put this back in the socket. You better knock my ass out. Which they said, don't worry about that. That's not going to be a problem. When it did come to that, about 40 minutes after I got to the emergency room, the anesthesiologist came. They gave me a dose of Versed. They put it back in the socket, and I didn't feel that. Thank God. So we're waiting to find out. The orthopedic surgeon comes and talks to me and goes, this is what we're looking at, and you need to have surgery. Like this, there's no two ways about it. So I'm like, okay, you know, I was kind of nervous because I didn't have Heidi to talk to bounce things off of. I had my friend John that I was bouncing things off with him. I had texted my manager at work and said, I'm not coming in tomorrow, and I sent her a picture, and her response was, holy fuck. So all of this ends up going through. By the way, one of the saddest things that I've ever seen is I'm looking up, and on the screen is the join the ASPCA thing, and I don't understand how people can treat animals that way. It's horrible. It makes me feel like complete shit. Anyway, yes, I'm messing with things. So they put me on the schedule. They're bouncing me around between third case, second case, possibly first case. It finally comes around that about 1 p.m. they were looking at doing my surgery, which was fine. Let's go ahead and do that. I remember them talking to me, getting all the contact information for Heidi, who to contact, and them giving me information of, hey, this is what we're going to end up doing. We're going to call her. We're going to let her know approximately how long the surgery is, what time she should be here for when you get out, everything else. You be quiet, and all of that. Okay, great. And that's the protocol that I'm used to hearing that happens from the hospital. Well, it went from being an 1.5 to 2 hour surgery to a 5-hour surgery. I didn't actually come out of anesthesia, and they didn't actually fully wake me up until 7:30 p.m., something like that. So I was out for a while. Heidi knew where I was. She never got a call. And this is Fresno Community Hospital. This is like in Central California. It is the #1 trauma unit. It's also the #1 burn unit in California. And anything that I end up saying is not against any of the doctors. The doctor care was perfect. I don't have any issues with that. All of my issues that I'm going to be complaining about has to do with staff and the facility itself and just how things were done. So she's sitting in the waiting room. She sees me up on the board. She sees that I've been marked clear. No one's come out. People have come out and gotten other people family members that had surgery, to give them updates, so on and so forth. No one came out. No one came to talk to her. No one came to check to see if anybody was even there for me. She called in the holding area. They have a phone there. You dial 0 for the operator. The operator is trying to help her. Like, no one called you. No one let you know. Basically, what the hell? So the operator, after like the 3rd time, finally got hold of somebody, and a staff member came out and said, you're here for David. He's actually out. Let me take you back. Da 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 da. Meanwhile, they're getting me woken up, and I don't remember. Here's the thing. They tell you that, like, when you go under for surgery, it's like the most relaxing nap you've ever had. I don't want to say it was relaxing. It was different. I will give it that, but it wasn't relaxing. I remember looking down. I didn't even know that my surgery had been done. Last thing I know, they were wheeling me in the operating room, and I'm like, they had some Pearl Jam playing. I'm like, well, at least someone has some decent taste in music around here. And they were all laughing, and I was joking with them, and that's just the way that I am. Anyone that knows me off of YouTube knows that I joke, and especially at work, I try and lighten the spirit. I know people that are hurting, and, you know, laughing can make people feel better and less depressed, and that was, it was partially for me, and it was partially also, I know what these people, as far as the staff, go through. Ow. You know, if I can lighten the spirits and everything, everyone knew that the doctors that I work for do surgery there, so there's surgeons there. I know how things are supposed to be being done. They wheeled me to my room. Okay, I have the post-surgery yak moment, which I guess is common. So I do that. On the way out, there was some lady, I think she was all coughing or something like that, and I yelled at her. And to that lady, I apologize. I was under the influence. I didn't know, but... so the wheel of they wheel me to a section of the hospital that is for post-trauma recovery, surgical recovery. Okay, it's called 2 East. Some of the nurses were awesome. Some of the nurses were just kind of there. I remember getting some water, and that's about it. And I couldn't stay awake, which was probably for the best thing. I just ended up passing out. The next morning ended up coming. I didn't get any breakfast because evidently they had me on NPO, which was still floating in the system. That was for my prior surgery, before I had surgery. I was dying to eat something. Like, I needed something solid. I hadn't eaten since like Friday or Wednesday afternoon. By the way, this isn't going to be a short video. I'm just kind of rambling. I got nothing better to do. So anyway, the first thing on a Thursday, or was it Thursday morning? Friday morning. They come in, the doctor comes in with a couple of staff members. They pull off the boot. Actually, they didn't even pull off the boot. They checked the drain. They drained the drain. They said, I had iodine like all the way up my leg and everything. They're like, we'll send someone in to clean up your leg because that looks pretty bad. We'll get PT in to, at least show you what you can and can't do, things like that. So I sat for all day. Heidi came, come visiting hours. She sat there. It wasn't until I bitched at someone that I got them to change my food schedule so that I could get some food. No one came to... I felt nasty. Like, I seriously felt nasty. I'd been sweating the whole time between being asleep, everything else. I smelled horrid. At no point did anyone say, do you want a washcloth? Do you want something? Hey, we have toothbrushes and toothpaste. It wasn't until Friday night, Saturday morning, that one of the staff that come around in the middle of the night and take your blood pressure and stuff asked the guy next to me if he wanted a toothbrush and some toothpaste. And I'm like, hey, can I get some? Like, and he was in shock that no one had just brought it. My nurse that I had for that night, she was so sweet and she was on the ball. And she's like, oh my God, like, I can't believe she brought me deodorant. She brought me some mouthwash. She's like, I can't, do you want some, my roommate at that time was just hacking up lungs. She's like, do you want some earplugs? And I'm like, how come I never, like, no one other than you has offered any of this? I have had to fight for pretty much anything that I know is standard. No one from PT ever came. By the time that it came around to that, and I was arguing with the nurses, it was time for PT to already go home, which was at like 3:30 in the afternoon. And they're like, oh, well, sorry, they must have skipped you. They must have been overly busy. They just didn't get to you. Sorry. What the fuck do you mean you just didn't get to me? Like, all I wanted to do was to know what I can and can't do. I'm laying in a stagnant position with my freaking leg in a boot. I don't know. I would love to take the 3 feet travel from my bed to the bathroom if I needed to go to the bathroom instead of peeing in a bucket. Friday night, when they were bringing in my new roommate for that night, they just completely ignored me bringing me my dinner. I'd placed my order. She had taken my order that afternoon of what I wanted and taken my order for the following morning. So about 8:30, one of the nurses, the rounding nurses, I have to give credit to the nurses that go around and they just do the vitals and stuff like that. They're not your nurse, but you guys know what I'm talking about. Like, they seem to be compassionate and know what was going on and actually give a crap about you. She's all, did you already finish? Did they come take your dishes away? I'm like, what dishes? From dinner? What dinner? Like, I thought maybe they hadn't even served it yet. I thought, she's like, oh my God, dinner was served 3 hours ago. Like at 5 o'clock. I didn't get shit. My new roommate was wheeled in with fucking food. So, God bless her, she went and she scrounged, I think it was probably someone else's that maybe they had left. And so it was called, I ate the yogurt. No, there wasn't even yogurt. I had apple juice. That's all that I ended up having. I was just so depressed and frustrated. And here's the thing. I work in the medical field, and you end up hearing stories from patients, and a lot of times you're like, oh, they're exaggerating and so forth. You know what? In this case, with this hospital that we end up dealing with all the time, no, they're not fucking exaggerating. This shit is actually happening. Now, granted, on the floor that we do surgery on and everything, like, we have our own nursing staff. Like, they know all the doctors. They know what everything is required and expected and so forth. I would have given anything to have been wheeled over to 5 West. Like, almost everyone that was in, like, was chained to their fucking bed. They had officers outside of their rooms to make sure that they didn't try to escape or so forth. Where the hell was I? Was I on the frickin' jail wing of the hospital? And it's not like I don't have insurance. I have insurance that indicates that I work for the same damn hospital that these people do. And I'm not expecting to get preferential treatment or anything. It's just like, can you at least treat me like a fucking human? So yesterday comes around, which is Saturday. Doctor comes in first thing and he's like, I am sorry about the miscommunication. And he thought I was talking about, because I thought that he was coming back Friday afternoon to check on it and remove the drain. Well, yeah, but no one came to clean me up. No PT came. And I'd already talked to the lead nurse, the head nurse, floor nurse. She'd seen that the order was in there and it was just skipped. It wasn't done. He was pissed about that. He tore up some ass with the nurses that were on the floor, and he wanted someone there, like, immediately as soon as they get in. Keep in mind, this was like 7 a.m. or so forth. I'm cranky. I haven't slept. I haven't eaten. So breakfast comes. I'm an hour overdue for my medication. I call, they give you this little thing that's attached to your bed, and it says nurse, and you hit the button on that, and then it goes to a hub station, and you go, whatever your need is. I need to go to the bathroom, I need my meds, so on and so forth. They tell the nurse comes. 4 times during my stay, I called, and it was about an hour before the nurse ever came. And the only reason that I had stopped her was I waved her down as she was walking by, that she never got the message from the fucking staff. So I doubt anyone from Community Regional Hospital is going to hear this. But you guys need to change some shit. You guys really need to step... It's lazy. It's just lazy. You can hear it on the tones of the faces, like when I call the nurse station and the nurse's station. Like, they don't care. It's a job. It's a paycheck. They could give a shit about their job. And that's sad. Like, I can't be that way with what I do with patients. Like, I can't. So... the doctor removes my drain. He goes, you're going to be fine for discharge today. We'll have you see PT. They'll do their evaluation and everything. I'm sending this picture to the surgeon because evidently it was severe enough that not only... Now, the surgeon that did my surgery wasn't just an orthopedic surgeon, but he was also one of the ones from UCSF, which practices out of the hospital. So that's why I didn't have any fear of, is this a crackhead doing my surgery? You know, and I know UCSF is a training hospital and everything. So I had good confidence in that. PT came, and I had difficulty like lifting my leg and getting mobile. I could stand using the walker and everything, but we had agreed that a wheelchair would be best. So discharge planning finally comes about 5 minutes to 3 actually, and goes, so here's what the situation is. PT put in an order for a wheelchair and a walker. With the insurance, they can't do authorization and get you authorized. We can't let you go without something, and we can't get authorization until possibly Monday. So you may have to stay in here all weekend. I'm like, fuck that. So I started making calls of places that I knew that my office deals with for DME and wheelchairs and stuff like that. Every place closed at 3 o'clock on Saturday that I could have even rented a wheelchair. There was one place that was open that I could buy a wheelchair, but I didn't want to buy something that I don't permanently end up needing. I didn't want to spend another $300-400 on a wheelchair that my insurance would cover and is in the process of covering, but I can't find out anything until Monday, or supposedly today. So they go through a company called Apria Healthcare. That's who's contracted with my insurance. I call them, they're like, oh, the call center is out of India. Is there any place that does not have a call center that's out of India anymore? He can barely understand what I'm saying. I'm losing my voice. I'm frustrated. And he's all, we have your order. We are processing, we are expediting. You will get a call tonight. You know, but just give us a moment and okay. So then I call back and the discharge nurse comes back, or discharge coordinator comes back, and she goes, so we can send you home with a walker because the PT put down a walker and a wheelchair. The insurance will automatically cover the cheaper of the two, which would be the walker, which I can't really use. Fine. I give a shit at this point. Give me the walker. I will hobble my ass one way or another in whatever pain to where I need to go. I call back Apria, and I get another Hindu person, and I can hear in the background, and I'm not making generalization like maybe I got a Hindu call center. I can hear in the background, everybody's freaking Hindu. And this gentleman's like, oh, well, it was put through as expedited. We have 24 hours to get back to you with whether they approved it or not. But to be honest, you probably will not get anything delivered until Monday. I am not staying in this freaking hospital another hour, much less another day and a half to 2 days. Much less, I already know the cost for each day that I'm staying in the hospital. Like, it was freaking crazy. Fine, just give me the walker. I'm on my way out. So then the nurse comes. She's got the paperwork for me to sign off. Take out my IV. Get this damn thing out of me. Your medications have already been called into your pharmacy. It's already done and taken care of. Okay. Wait a minute. It's 20 minutes to 5. I call the pharmacy. They close at 5. Now, I know both the pharmacists at the pharmacy that I use, which is right up the street, and they were like, yeah, we got the prescription orders and everything at 2. We have them. They're ready to be picked up. You can send anybody to come pick them up. They just have to know your name and your date of birth. We will give them to you for you. You know, and basically doing that as a favor to me. Problem is, I didn't have anybody within 20 minutes distance of the pharmacy to be able to pick them up for me. You know, one of my best friends, he was up at Sequoia. So then I end up calling my doctor and getting an e-script put through to CVS, a 24-hour pharmacy, and, you know, thankfully he ended up doing that for me. The doctor, the orthopedic doctor that's on call for Community Regional Medical Center here in Fresno, doesn't even have a damn DEA license. I heard him on the phone with the nurse. Even her jaw kind of hit the floor. No one has heard of this. Like, because she's like, well, can you write a hard copy? That way they can just take it to the pharmacy. No, I can't do that. I'm not at the hospital. Can you do an e-script? No, I can't do that. I don't have a DEA. I don't have rights to write for narcotics. What? What? So, they wheel me down. I get in the car. I am so riled up at this point that I feel like I probably could have walked home. Get in the car, make the ride all the way home. I hobble my ass in the house.